Good afternoon. My name is Zoe Clark, and today I've chosen to elaborate on the topic of experiential learning, focusing on clinical debrief, then showing a case that I attended on my recent placement as an example as to how experiential learning can be utilised in paramedic practice. So what is experiential learning? Experiential learning is the process of learning and educating through first-hand experience. It refers to the skills, knowledge, and experience that is acquired outside of the traditional classroom setting. It is usually utilised in contrast with lectures and theory learning. Experiential learning is often misunderstood as a set of tools and techniques to provide students with experience. It is actually a continuous learning process in which people bring their own knowledge, ideas, and beliefs to their understanding and interpretation of information being taught. In regards to healthcare teaching, specifically paramedicine, this learning process is one of the most effective ways to create self-functioning and critical thinking clinicians. According to Paul et al. 2014, knowledge is the result of the interaction between theory and experience. They cited that learning takes place in 4 stages, which are concrete evidence, the learner actively experiments with a concept, reflection observation, the learner consciously reflects back on the experience, abstract conceptualization, the learner attempts to generalize a model of what is experienced, and active experimentation. The learner then applies that model to a new experiment. I want to focus on the step of reflective observation during this speech. Within paramedic practice, one of the most important skills to possess and utilize is a clinical debrief. During university and throughout being a professional registered paramedic, students and clinicians alike should all participate in some form of clinical debrief. This could be in the form of a facilitated discussion after a simulation, or as an informal discussion with your partner about a job that you just attended. In a study conducted by Garden et al., it was found that performance among clinicians improved after debriefing on their simulations, whereas performance stayed the same for those who did not debrief. During university, as a student paramedic, one goal for clinical education is clinical judgment development. This can be achieved through debriefing after simulations as a form to enhance this development through creating critical thinking clinicians. When researching the importance of experiential learning in healthcare, a study done by Newswire found that experiential learning has been shown to cause improvement in healthcare outcomes, with the most remarkable improvement being a 10% decrease in infant mortality in the hospital that the study was conducted in. This highlights just how important it is as a clinician to continue your development through debriefing and active learning. So how does this all relate to teaching paramedic students at university and paramedic practice? Well, one area I would like to focus on for this speech is the use of experiential learning, specifically within a university setting. Paramedic students need to acquire knowledge in order to perform basic and complex clinical skills in such a way that is safe and patient-focused. Some of the best opportunities for students to learn these skills is through simulations and clinical placements. It has been found that healthcare graduates often lack the necessary communication and clinical skills to practice in a collaborative environment because they have been educated in classrooms with little or no interaction with other healthcare professionals. That is why an important element for the paramedic degree is real-life exposure to patients and jobs. If students did not attend clinical placements, then graduate paramedic quality could be reduced, as students would have to rely on simulations and scenarios as their real-life experience. The exposure and active learning that is done on clinical placements can provide students with a better understanding and the ability to take on what they have learnt in lectures, applying that knowledge to real patients. In saying this, it is the student's job to keenly seek out learning opportunities whilst on placements. Students need to be active learners, doing as much as they can on placements, and should seek out feedback and constructive criticism from their mentors. A study conducted by Boyle et al. Showed that students who were self-motivated and reflected on their practice with skills such as assessing patients' injuries, moving stretchers, taking blood pressures, and developing communication skills had a more positive overall placement experience. The study goes on to talk about the importance of critical reflection, and those who undertook a placement where they wrote a critical reflection journal overall felt more confident in their abilities as a practitioner. This is important as experiential learning while on clinical placements leads to having more positive overall experiences, not only for the students, but for the mentors as well. One skill that is hard to teach in a classroom setting and can only be learned through experiential learning is communicating with patients. This is especially difficult with patients that students may not have experienced with, such as in patients who students may not have much experience with, such as older people and people with disabilities. A study conducted by Ross, Jennings, Gosling and Williams found that paramedic students with communication skills already in older patients from previous work or experience had a good baseline in their study and improved from good to very good post-experiential learning on clinical placements. As can be seen from the literature, experiential learning in a university setting is important in order to enhance the experiences of students. This will result in more proficient clinicians once graduated and working on road. So how does experiential learning continue into being a professional paramedic? Experiential learning does not only relate to paramedic students, but also continues through into paramedic practice. Now that paramedics are registered healthcare professionals, it is imperative that clinicians make sure they're up to standard. When looking at the Paramedic Code of Conduct on the APRA website, one of the codes is called Maintaining Professional Practice, with a subheading referring to Continuing Professional Development, or CPD. It states that maintaining and developing knowledge, skills, and professional behaviour are core aspects of good practice, and goes on to say this requires self-reflection and professional development. This can be done by reflecting on practice and skills, as well as seeking out improvement to better yourself as a paramedic. As a registered paramedic, this can be done through many different routes, such as attending CPD events in relation to clinical topics or wellbeing topics. It can also be done through having a student on placement and talking with them about a case or giving feedback on their professional practice. Or it could finally be from talking to your partner or other co-workers about a job that could have gone better. In actively participating in professional development, it means that paramedics will continue to better themselves, resulting in better healthcare for patients. As seen from the Code of Conduct and current literature, experiential learning and clinical debriefing are both relevant to paramedic practice as they play a role in the continued education and betterment of all clinicians even after graduating from university. Now I would like to go over a case that I attended whilst on my placement this year that highlights the importance of experiential learning. Over the course of my degree, I have been lucky enough to have participated in 18 weeks of clinical placement on road. During this time, I have had exposure to a multitude of cases ranging from low to high acuity. One case that I was primary officer for was a mental health job where we attended a patient who was having a psychotic episode. I felt comfortable running this job as I have had previous experience with mentors at similar jobs, where I watched and listened to questions and techniques that they used. When we arrived, the patient was agitated and in obvious distress, pacing around the house. Now this case could have gone two ways. First was what could have happened if I had no involvement in similar cases. I could have been naive and approached the patient without building rapport and picking up on the patient's body language. And this could have led to me or my mentors being in danger or getting hurt, and the patient never getting the help that they obviously needed. But because I had experience and had actively learned through other placements about how to de-escalate a patient and situational awareness, I was able to build rapport with the patient and talk him to the point where he was calm enough and understood what was happening, that he would come with us to hospital and get the help that he needed. When reflecting on the outcome of this case, I now have the understanding and appreciation that it could have gone very wrong if I wasn't educated through university the way I was and didn't actively participate on my clinical placements. This case highlights to me the importance of experiential learning, and I will always continue to learn and grow as a clinician. In conclusion, experiential learning is a vital aspect of paramedic practice and is important for students to continue doing as they transition from university into professional practice. As a paramedic, it is important to always be up to standard and deliver the best healthcare to patients in the safest way. The knowledge that I have gained while writing this speech and reading the recent literature surrounding experiential learning and clinical debriefing has given me new insight into how I would like to implement the things that I've learned from clinical placements into my future practice as I transition to a qualified healthcare professional. I believe this will not only make me a more clinically adept clinician, but also a more understanding and holistic paramedic. Thank you.